Okay, now we are at maybe our new favorite segment.
Ooh.
Ask the doctor.
So many questions.
We have so many questions for you.
Okay, fire away.
Okay, so our first question.
Mhm.
Ozempic, is it good? Is it bad? What are your thoughts overall?
Overall, GLP-1 inhibitors have been probably the most popular or biggest revolution in obesity treatment the past few years.
Mm-hmm.
We have such a problem with obesity that any effort to make a dent in it, I think, is overall a great thing for medicine.
Yeah.
And I'll put a caveat in here as I'm an orthopedic surgeon. I don't directly prescribe these medications, but I do. I see a lot of my patients on them and see the benefits of it.
Okay, what about skinny people taking it?
And also taking it to lose a small amount of weight, like, not doing it for like you actually are obese and you need it.
So the estimates that I've read with the Ozempic and some of the current generation of you're losing about 10 to 20% of your body fat, which is there's a lot of patients that would really benefit from that. But so if you're starting relatively skinny, you're only going to lose 10 to 20%, and you just don't have that much to lose.
But what about someone's like, I only want it to lose 5 pounds. I need to lose 5 pounds, so I'm going to go on Ozempic. But maybe that's 10 to 20% of their. No, that can't. 10 to 20%.
They're
no,
50
they can't take this. That's not right.
Math is not our thing.
No, wait.
Okay, so overall, you're a fan. You think it's a medical breakthrough.
In my practice, I've seen a lot of patients have substantial benefits in their joint pain.
Mm-hmm.
They lose 40 pounds, say, and their knee pain is tolerable, and then they don't have to talk to me about getting knee replacements.
And that's what an orthopedic surgeon does, right? You're like the bones.
Yes. Yeah, I'm bones and joints.
I watch Grey's Anatomy. I'm on season 11, so I think that makes me like almost a doctor, possibly.
Yeah.
And I believe Sarah Ramirez's character is an orthopedic, I think, because she like breaks bones and helps people.
I have not.
Right?
See, I've not seen the
with
show.
Their bones.
I do not.
Is that what you do? Break bones?
More or less.
Okay,
in a controlled manner. Yeah.
God.
Controlled manner.
We are learning so much.
A question though about the Ozempic. What about the long-term effects? Because I know it's been around forever, but it hasn't been used for weight loss forever.
It remains to be seen, what the long-term data is for how long do you need to take them? How long do the benefits last when you stop taking it?
Right.
And then kind of long-term effects on muscle mass loss and bone density loss.
Yeah.
So a lot of long-term data now with huge populations of people taking this medication. So a lot more studies to come.
Stomach paralysis or stomach. There's something with like this. Have you heard that? Like people
heard
well, that's what those medications, or one of the ways that they work is it slows gastric emptying. So you can, one of the side effects of it is gastroparesis, meaning it's really not emptying at all. So it's more of a kind of an intended side effect, because that's how the medication works. But if you're getting it to the point that you're getting gastroparesis, you have to change or stop taking it, or it's just not working for you.
Wow. Okay, great. Love it. All this is so good. AI, I want to talk about a little bit, because I feel like people are like self-diagnosing themselves with AI. I guess this also existed before with, what was it?
Was
WebMD.
WebMD.
Yeah.
Does that annoy you when people come in and they have like already diagnosed themselves? Or are you like, oh, that's helpful. Maybe that is what you have. Maybe that is your problem.
I think I'm fortunate as a doctor is usually there's not much of a mystery of what's going on in my patients. Like my knee hurts and but I think it's good practice as a or any healthcare provider that when you're meeting a new patient, having some sort of a idea of what the patient's preconceived notion is, it helps your relationships and kind of guides you where to start the conversation of what's going on and what brought them into the office.
What if you're
Okay.
only using AI instead of going to a doctor? At what point do you need to see a doctor if you're using AI? At what point is it?
Well, they can't
I
prescribe
Not like
anything.
this is a real
yeah,
thing
AI
that
can't
I
happened, but
prescribe
like if
anything.
I
I
was just
no
like
one should
using
be
AI for medical advice, at what
yeah,
point do I need to see a doctor? Hypothetically.
um, broad question, but yeah, no one should be using an AI agent in substitution
Of a doctor. Okay.
for
Right.
Great.
real medical
Fair,
advice.
fair.
Yeah.
Makes sense. What about those the full body scans that all the
Oh,
Kardashians are
yeah.
obsessed with? Is
We wanted
that
to ask you about those.
I would not recommend anyone get those studies.
Full body scans. You're
Do you-
anti.
yes. So full, MRIs are very sensitive tests. I mean, they're gonna pick up a lot of things.
Mm-hmm.
And there's studies with these full body scans that 95% of people, you're gonna pick up something. And an MRI report for full body scan is pages long. They're very sensitive studies, pick up a lot of anatomy. Also going to pick up, we use the word incidentaloma. So like little nodules, lumps, bumps, things that you would never find because you would never have a reason to get an MRI at this part of the body.
Mm-hmm.
And then you have to decide, okay, what are you going to do with that information?
Freak out.
freak.
So
You're gonna freak out.
So it's the MRI reports for patients who are not used to reading them, even for a knee MRI. They're very detailed, and patients get these and like, oh, I have 5 bullet points worth of things that are wrong with me. It's like, no, you're okay. So these full body scans, they pick up a lot, and they really lead to a lot of follow-up visits, specialty visits, more imaging, more testing, biopsies, unnecessary procedures.
And I'm sure sometimes it's helpful. I'm sure sometimes once in a blue moon, somebody finds something that they're like, oh my goodness, thank goodness I found that in this full body scan. But maybe some of the things aren't necessary.
Ignorance is bliss, right?
Bottom line, the risk is not worth the reward for doing those studies.
I like hearing that because I don't have the money for these body
Yeah,
scans.
they
Also,
are expensive.
they
the medical
are,
opinion.
they're not covered by insurance
Yeah.
for good reason.
Yeah.
Unless there's a few rare genetic conditions that put you at a higher risk of getting cancer, but those are few and far between. And I highly discourage patients from getting them. I have a lot of conversations with patients on anytime you're gonna order especially invasive or expensive test, you're gonna have to prepare yourself as the doctor and the patient. It's like, okay, what are we gonna do about the information that we're getting? And if we're not gonna do something about it, then why get the study?
Right.
Yeah.
Yeah.
If you're getting a full body MRI scan just to see, it's just, okay, are you going to do anything about what we're going to find there? It's like, no, you just want to know. But then now
you're going to
are we
freak
going to do
out.
something?
Yeah.
Or is it going to increase your anxiety with all the findings there? So I
Right.
really caution everyone against getting those.
Wow, interesting. It does seem so tempting though, because it's
It
like,
does.
oh,
Would
but
you
then I
want to
would just
know?
know.
But then,
yeah.
like, I don't think I'd want to know that, like, in 30 years, I could have X, Y, or Z, and there's, like, really nothing proactive that I could do about it now.
Mhm.
I don't know. It's kind of like finding out the future.
Right.
But maybe it's wrong because it's too much information.
Right.
There's a lot of based on your history, your family's history, and just overall kind of population based recommendations on when, or meaning what age to get certain studies. So not necessarily an MRI, whether it's a screening colonoscopy, a chest X-ray, ultrasounds, mammograms, those type of things.
That's fair.
I love that. Okay. What is a symptom you should never ignore?
Ooh. Things that always concern me when patients mention it is we call it unexplained weight loss. If you're not trying to lose weight and you really start to notice you're losing weight, that's something that needs to get checked out.
Yeah, that
Yeah.
is actually, I always hear like when people like that is one of the first symptoms where if someone gets really sick.
Yeah, I saw a TikTok about that. Like,
Really?
symptoms you can never ignore, and that was a top one.
we call
Wow.
Yeah.
we call those red flag
Yeah.
symptoms.
Okay.
And so
Oh,
that
wow.
the one that comes
Anything
to
else? That one?
mind. Unexplained bleeding, whether it's rectal bleeding or
Oof.
postmenopausal menstrual bleeding. Those are both very concerning.
Okay, our final question for you. What is something you can tell about a person's health just by looking at them?
Ooh.
So something that I look at quite a bit in my practice is patients' feet.
I know, isn't that shocking?
Wait, what? Okay, let me know.
When I see a patient's feet and whether they have wounds on it, it's more of a symptom of a patient's hygiene. Whether it's they're not really taking care of themselves, or if they have mobility problems, or just physically reaching down to their feet, or if patients with diabetes who they can't feel it and they don't notice something is going on down there. It's kind of a window into patient's health status.
Wow.
Wow,
Isn't that shocking?
Well, reflexology, which is like the massaging on your feet on certain pressure points and how that like can affect the rest of your body. I wonder if there's like a connection to like you being able to see that and how the feet can be healing in like Chinese medicine.
Maybe. I think we're just not talking about feet enough
We don't talk
in
about
this
feet
country.
enough.
Yeah, we
don't.
just don't,
But what about like high heels ruining your feet? Is that a medical condition or is that just my
Oh,
high
sure.
heels?
Yeah. I
There's a
don't
difference, right, between like
I don't do a lot of work with like foot reconstructions,
Right.
like bunions and things like that. But high heels are really put a lot of pressure on that your
Oh,
first
but they're so
metatarsalphalangeal
cute.
joint,
They're
and
so cute.
there's gonna be a lot of wear and tear, or I've seen plenty of ankle fractures and some mishaps with high heels.
Oh,
Sorry,
Yeah.
Carrie Bradshaw. That's really sad.
dang it.
Yeah.
That's
So
bad
sad.
news for us.
Such bad news.
Do you have any like health advice that you would want everybody to like hear?
Um.
Get sleep. That's a big
Oh
one.
yeah,
Drink water.
the
Drink water.
easy answer to a lot is diet, exercise, and sleep.
Mhm.
That's
Check,
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 solves-
check.
it's not going to solve every problem,
Check,
but it
check,
is
Yeah. It'll
goes
help.
a long way.
There you
Wow,
go.
we love it.
We love that.
Oh my God. Well, thank you for being here.
Thanks for inviting me.
doctor.
Thanks
Yeah.
for all the
This is
questions.
huge.
So I don't have to go
Wow.
see a doctor for a while now.
No,
because
you're
of
good.
Yeah.
Actually, you
that.
got out
We're
all your
good. You
questions.
too, listening,
I
watching.
think we're fine.
We're fine.
Yeah, no body scans here.